After fears of widespread refusal to comply with the current 14-day self-isolation guidelines, the government is drawing up new rules that could see it slashed to as little as 7 days and even make some travellers totally exempt from all quarantine.
But will halving isolation times increase public compliance and limit the spread, or could it have the opposite effect? To discuss this, we're joined now by Professor Devi Sridhar, Chair of Global Public Health at Edinburgh University, and billionaire businessman and philanthropist John Caudwell, and Dr Hilary, of course, is with us as well. Professor Sridhar, thanks for joining us, as always, on Good Morning Britain this morning. So, this reduction from 14 days to 7 days, in a nutshell, can it work?
Well, you're trying to get the balance right between the incubation period of the virus, which could be up to 14 days. So you could test negative and still develop the virus later on, which is why we have that, as well as compliance. But I think we have to get back to the core reasons of why people aren't doing it. It's really hard financially and emotionally. We're social, we want to see others. So I think we have to get back to how do we support people, whether it's 7 or 14 days, to be able to comply with this, which is what is a big ask, to kind of not stay away from lots of other people and stay away from work for an extended period of time.
And Devi Sridhar, I mean, Matt Hancock's been speaking about this morning. He said it's not about compliance. This is about clinical judgment. But the suggestion is it's because not enough people have been doing it and they need to make sure that more people do it. And is it better for more people to be self-isolating for 7 days than fewer people to be self-isolating for 14 days?
Yeah, no, that's exactly right. And that's what we've seen in France, which has already moved to 7 days for those reasons. I mean, a way you could get around it is to use testing. So what you could do is test, let's say, contacts. So these are people who have been exposed to the virus, who have been asked to isolate for 14 days. You could test them after, let's say, 3 days, test them again, 8 days, and then actually they could get released earlier in a safer way because you test them twice. And after having 2 negative tests in that period, yes, you'll miss a fraction of cases, but we need to focus on catching the bulk of cases rather than right now where studies are showing only 11% of people are actually isolating, which is, a big reason why our test, trace, isolate system is not working as effective as it should be.
So without a good track and trace system, which we are hearing it's not as good as it could be, without people abiding by the rules, whatever they are, and self-isolating, this maybe will have no effect then.
Yeah, I mean, the main thing we're going to see is people are going to be stuck in lockdown and release cycles. We're already seeing it. And countries that have said we'll never again lock down are going into lockdowns again. Look at Spain, look at Italy, France, Israel, and the United States as well is going to face these hard choices in the future if their numbers increase. And so I think we can say never again, but unless we put in the prevention measures, including an effective public health infrastructure and making sure reimportation isn't occurring, we're going to be stuck in these cycles. It's just what's been modeled out for a year and a half. And so we have to break that spiral somehow, and this is the way we can do that.
John Caudwell, coming to you. I mean, do you think Devi Sridhar was there saying, obviously, a self-isolation period of 14 days is tough for people financially, emotionally? It's difficult for members of staff who have to take that time off work. It's difficult for businesses, isn't it, who then potentially have members of staff off for extended periods of time because of this. Would you welcome a change like this?
Yeah, yes, of course I welcome a change like this, but I think it's really scratching around at the edges of what's going to make a difference. These are tiny, tiny tweaks, but some of them are sensible because they're talking now about allowing chief executives to travel without quarantine. And I'll give you an example of the stupidity of the rules at the moment. I'm not criticising the government for this because the rules are so complex and so many different variations. But I held my children's charity for Caudwell Children in Monaco a month ago. And I went across, we raised €1.3 million. But
oh, we're just having a bit of difficulty with the connection to you, actually, John. Can you still hear us?
I can, yes.
Oh, right. OK, carry on in that case. You were just saying that you'd were on this charity mission. Keep going.
Yes, and then I had to quarantine for 2 weeks. Meanwhile, cross-border workers, they might be plumbers, builders, bricklayers, whatever, could travel backwards and forwards quite freely. So the rules are very, very mixed and very illogical. But of course, it is a huge challenge for the government to get all of this right, including these all these lockdown rules. And that's why we have such a huge amount of confusion in the public and so many people disagreeing with so many different measures.
Yeah, so there was this suggestion that people like city dealmakers, hedge fund managers, company bosses could be exempt. We did hear from Brandon Lewis yesterday, who said any changes that are made will apply to everybody. From your point of view, as a company boss, would you be worried if staff were coming back after 7 days? We've had all this advice for however long saying that we need to self-isolate if we've been in contact with someone who's tested positive for 14 days. So would that be a worry that staff might be coming back too soon?
No, because this is where the nonsense is. People are travelling back often from countries where the incidence of corona is way lower than ours. The new cases per day are way lower, the percentage of the population is lower, and yet when you travel back from those countries into our country where the cases are 20,000 a day, you've got to then isolate for 14 days as if you've caught the plague out in those countries. And I think it's just a matter of being sensible, taking the appropriate precautions, use your sanitizer, the face masks, and avoid close physical contact. And I think if you do all this, then whether you're travelling back from Italy or Spain, the risk is probably no higher than going to a British supermarket. So why impose these massive restrictions?
Professor Sridhar, you've talked about how that we need to be better with border control. That is one of the measures that needs to be in place alongside track and trace. And then you look at what the length of quarantine is. But unless you have these basic precautions in place, and nothing will work. So going on what John has just said then, are we being a little bit unfair? This idea that you might be coming back from a country that's got a far lower rate than what the UK has. So does it make sense that those people should be quarantining for 7 days or 14 days?
Well, I think as a whole, we should look to which are the countries which are, winning at this, crisis in terms of saving their economies, keeping their aviation industries afloat, keeping COVID numbers low. And how they're doing it is through testing. And this is what Germany has in place now. If you fly from the UK to Germany, you can either quarantine for the 2 weeks, or you can get tested at the airport for free. And then if you have a negative test result, you don't have to actually quarantine further. Or you can bring a negative test result 72 hours before you fly and then show that if it's from another EU state and get through quarantine. So I think we need to be more innovative as saying, how do we actually create a system for all, not just for high flyers, not just for certain other workers, but actually for anyone who wants to fly to either be able to bring a negative test result forward or to be able to get tested at the airport for free on arrival, which Germany and Italy have introduced as a way to keep international movement going, but in a safer way. So you're actually trying to catch cases of people who might be, coming in from other countries, especially higher prevalence ones.
Let's bring in Dr. Hillary at this point, because Hillary, we spoke to you earlier on this morning, didn't we? And we were talking about this potential change, about what might be behind it. Since then, we've heard from Matt Hancock, and he's been saying it's not about compliance, it's all about clinical judgment. So what do you make of what he said from that point of view?
Well, I completely agree with Professor Sridhar there. Look, it take things to an extreme. If you keep people self-isolating for 14 days, you almost guarantee that if someone abides by that they're not going to spread the virus when they come out of self-isolation. If you only isolate them for 1 day, they're going to spread the virus if they've got COVID-19 or it's being incubated within their body. 7 days, we don't really know yet, which is why it's got to be evaluated. Test and trace would avoid the problem completely, but there is a real gamble here. If you say it's going to be a quarantine period of 7 days, you could make matters worse. Why would you make it worse? Because you still might not get people self-isolating for those 7 days in the first place. And then if you say 7 days, you're still going to miss some people who are still incubating the virus anyway. So it's a bit of a gamble, and that's why it hasn't been decided yet, and SAGE are looking into it.
OK, thanks, Dr. Hillary, and thank you to our panel. Thank you, John Caldwell, for joining us as well this morning. Professor Devi Sridhar, thank you. Loving Superman behind. It's not it was Superman this morning, not Snoopy. It has been in the past. Incredible. Yeah. Are there any options coming in the future? Can we expect anybody else behind you on the wall?
Well, there's Banksy in the bath.
Oh, there is.
Oh,
yeah,
there's a Banksy there. Fantastic. Listen, your incredible job. We should all have pictures of Devi Sridhar behind us when we're Zooming, to be honest. You've been so great. Thank you so much. And thank you, John Caldwell, as well.